Well, the COVID-19 crisis is causing financial hardship for many, along with stress, anxiety, and of course, isolation. To get an understanding of how these factors are impacting both alcohol use and family violence, a survey of frontline workers has been undertaken across New South Wales by Women's Safety New South Wales and the Foundation for Alcohol Research and Education. Joining me now is Hayley Foster, the CEO of Women's Safety New South Wales. Thank you very much for your time, Hayley. Now, by going right to the source during this very strange and uncertain time when our mobility, our social contact has been very much restricted, what role is alcohol abuse playing in family and domestic violence incidents?
Yeah, look, we've asked frontline workers right across the state in what's really a first of this kind of study in Australia, and we've found that it's actually playing quite a big role. Look, we know that alcohol misuse is not the cause or the key driver of violence against women. That's around gender inequality and disrespectful attitudes towards women. But we do know that it can increase both the prevalence and the severity of gender-based violence and domestic and family violence. And that's exactly what we've found when we've spoken to those on the front line.
Hayley, for women or for men even who are reluctant to come forward and engage with support during this time, what's the first step out of a domestic and family violence situation?
Yeah, look, it's really, really important to know that whoever's, if you're in that situation, that you are the expert of your own situation. People who are experiencing violence are already doing so many things to keep themselves safe. But know that if you're in a situation like that, that if you can reach out and maintain connection with the people around you and reach out for support, there is support there. 1-800-RESPECT, 1-800-737-732 is always there for you to support you. And there are support services there, so health services as well. One of the things we found in this study is that many people are actually presenting at drug and alcohol centres and other mental health and other health services, instead of not necessarily straight away at domestic violence services. And what we're calling for is more of an integration between those services, so better referral pathways, because we need to make sure that, of course, that we're looking after our health, but we're also looking after our safety. So, you know, wherever you can go to reach out for help, just taking that first step is really important.
Now, there's been some relief for domestic and family violence services in New South Wales, Hayley, by way of an extra $21 million in funding from state and federal coffers this week. What services will be supported by that allocation, and where are the gaps in that safety net?
Yeah, look, we're really pleased that both the federal government and the state government here in New South Wales have heeded our calls for additional support. It did take a little bit of a while to hit the front line, but we are pleased. It's $8.8 million from the federal government as part of that $150 million package, but another $12.8 million that the New South Wales government has fronted up as well. So they're recognising the seriousness of this crisis, which is fantastic to see, and it is going to hit the front line, which is very important. Listening to the sector around where those gaps are, but also where those higher risk groups are that might be having difficulty in accessing services. One area that we would like them to heed our calls is for women on temporary visas who are trying to access support, because that particular group have very little access to income and accommodation. And as we saw very recently, a very terrible death, where she didn't actually have any access to support. So I think there are gaps. We need to continue to work with the government to make sure that we fill those gaps, but also with the economic slowdown that we're seeing, we must recognise that domestic and family violence isn't going to go away soon. We need to have sustained and ongoing commitment from the government and investment in this in order to make sure that we keep people safe.
Let's hope those stresses are relaxed and the funding gaps filled there. Thank you very much for joining us, Hayley Foster, CEO of Women's Safety New South Wales.
Thanks so much for having us.
And if this story has raised any issues for you, you can get help by calling the National Sexual Assault and Family Violence Counselling Helpline 1-800-RESPECT, which is 1-800-737-732.